Professional associations for behavioral health are starting to address racism. And to speak about this, we're going to speak about the American Counseling Association's efforts in this regard. And to discuss this with us, I have Dr. Ebony White. She is a licensed professional counselor and a clinical supervisor. She is an assistant clinical professor in the Department of Counseling and Family Therapy and the program director of the Master of Addictions Counseling program at Drexel University. She is also the executive director of the Center for Mastering and Refining Children's Unique Skills, which is Marcus, the president-elect of Counselors for Social Justice, and the immediate past chair for the North Atlantic region of the American Counseling Association. So Dr. White, thank you very much for being with us today.
Thank you for having me.
And I know you have presented for us, which has been awesome. Dr. White's courses are absolutely fantastic, and she is a true expert on efforts around anti-racism. And I noticed that you are part of ACA's Anti-Racism Commission. So, I know that other professional associations in behavioral health have also been making these efforts to address racism within the professions themselves. So I think it'd be super helpful to hear how did ACA's, American Counseling Association's Anti-Racism Commission come about? You could tell us a bit about that.
Absolutely. So under the leadership of Dr. Sue Pressman, she was able to be at the helm of the Anti-Racism Task Force. And so folks who were appointed to that committee really worked hard to identify things they would like to see the larger organization, American Counseling Association, do to address, like you said, the historical racism and continued exclusionary practices that have existed in the profession, particularly within the organization. And so from that came recommendations on ways in which the task force would like to see ACA move forward. As Sue Pressman was exiting out of her role, Dr. S. Kent Butler, who's the current president of the American Counseling Association, he then was at the helm of appointing the Anti-Racism Commission. And so that is a 2-year appointment. And, the commissioners, we're tasked with seeing those agenda items, those initiatives. We're tasked with seeing those things move forward, as well as being a voice in the process of, basically, all initiatives that have an impact on the constituents, particularly marginalized folks within the profession. So across levels, whether they're counselors, supervisors, counseling students, and of course, the communities that we serve.
Oh, yeah. And what are those specific tasks that the task force wanted done? Like, I know that ACA came out with the anti-racism statement or policy. Is there work being done to do the research on systemic racism, throughout the history of the profession? What are those tasks that are being done?
Absolutely. And I should have had the foresight to know that you were going to ask me that, and I don't want to get them wrong. So I'm pulling them up to be able to read them.
Sure. Yeah, no problem.
All right. And so there were a few on different levels and they were condensed down. But I'll just broadly say that on an individual level, we wanted to make sure ACA played a large role and training on decolonized theories and interventions for working specifically with Black clients, making sure that anti-Black racism reform, advocacy, and activism is occurring at all levels, creating leadership pipelines for marginalized POP, specifically Black people in the leadership pipeline, because historically, if you look not just at the national level, but at the state level and even nationally, when we think about the divisions, there hasn't been a lot of diversity with the exception of organizations like the Multicultural Counseling and Development Association, and then also Council of Social Justice. There hasn't, but even in that organization, there hasn't been a lot of visible diversity among leadership, nor have pipelines been created. And so looking for opportunities for that, as well as taking another look, an assessment at our strategic plan and bylaws, our core mission and vision, to make sure we aren't just using language and we aren't just given this blanketed approach to rooting out racism within the profession, providing opportunities as well for those who are the most vulnerable to even attend conferences and get sponsorships really into the profession. Also advocacy around the journal, the Council of Journal Editors, so that they're developing programs that promotes and includes research and scholarship from a diverse pool, namely Black researchers, and also looking at revising even how we look at ethics as well. And then finally, legislative practices as well. So looking at we know that ACA is a signatory on the Leadership Conference on Civil and Human Rights. And so how are we addressing Congress, and what are the things that we are promoting? For example, when we think about policing in Black communities, how are we advocating on those fronts for things as specific as prohibiting chokeholds? Because we see, and we've all agreed upon, all the counseling organizations have agreed that advocacy is central to the counselor identity. And so we want to see that advocacy take place so that we are better serving our client populations. I know that was a mouthful.
Yeah, the commission is doing a lot. So is the commission like sitting in on committee meetings? Like, because each of those things you mentioned, I imagine that there's probably like committees that handle those areas, and would people within the commission be kind of sitting in on those meetings or looking at what those initiatives look like, and then saying, okay, well, what changes can be made in regards to these initiatives to promote anti-racism?
Absolutely. And so in general, there's, I believe it's 9 key areas. And the way we do it is our commission, we meet right now on a monthly basis, but we have kind of like, I'll say, a group chat. But when you're an ACA member, you're part of different communities, and our commission has their own community within ACA where we get to communicate to each other throughout the month, right? And so even though we're just meeting monthly, we're not communicating with each other just monthly, but we meet monthly as a way, as a check and balance. We have homework assignments every month as well. And so with each initiative, there's also on the ACA side, an ACA faculty that's assigned to ensuring the initiative is taking place. And so each month they give us updates on where they are. And if we have questions, we can say, listen, what's happening here? Where exactly are you? What is the timeline for this? What are the steps that we're taking in this arena or in this area? So to your question, yes, as a commission, we meet monthly. And in that meeting is the CEO of ACA, as well as we have staff assigned to us as well who's there. And so it's a bunch of us who are keeping track of the progress that ACA is making on all the initiatives that are laid out. And I really do like that we now have a document that we can refer to say, okay, these are our initiatives. This is who's assigned to that initiative in case you want to follow up in the in-between. And we can see exactly, okay, so this was done, this needs to be done. We spoke to this person, we're waiting to hear back about, A, B, or C. And so we're able to, when you have a checks and balances process like that, then you're able to more efficiently push forward initiatives because nothing is getting put on the wayside. We're constantly having these conversations.
Yeah. And what about looking at systemic racism in the past in the profession? Is something being done, and is there research being done in regards to that, and then informing the profession about that research, about that history? Because it seems like being knowledgeable in history helps people realize the need for focusing, having a lens of anti-racism and recognizing when something might be racist that they're not aware of, but kind of seeing how things played out in the past can build that awareness. Is anything being done in that regard?
Absolutely. And so the person who's the leader of the Anti-Racism Commission, her name is Dr. Tanya Tinsley, and she's held many roles, but one of those roles is she's a former president of the Association for Multicultural Counseling and Development, which is one of the largest, if not the largest division of ACA. And so they've been great documentarians, and they have already done a lot of work acknowledging and really there's a word that I'm looking for that is escaping me at this moment, but documenting the history of racism in the profession. But there's a word that I was looking for that's not coming to me. And so I bring that up because I want to let you know that outside of the commission, people who aren't even on the commission, there are many committees and task force and individual researchers who are doing and have done this work. A colleague of mine, Dr. Michael Hannon, myself and another colleague, Houston Fleming, we just submitted a paper really doing a timeline of the history of racism, particularly anti-Black racism in the profession. And all of that serves as documentation and artifacts that's going to inform the consultant that we bring in. And so that's where the Anti-Racism Commission comes in, because we are the ones who are reviewing those consultant RFPs. We are the one giving our feedback. We are the ones setting the tone. And when the consultant comes in, they have to do a deep dive and look at the history in the profession before they even make their, do their initial diagnosis, I'll say, using clinical counselor language, right? They have to do that assessment and get that historical knowledge. And so the great thing is, various divisions within our larger organization, as well as a lot of the committee members on the various committees in ACA, as well as individuals who are members of ACA, have done a really great job of documenting the history of racism within the American Counseling Association and the greater counseling profession. And so a lot of that information we already have. It's just about pulling it together in one place. And then the consultant will be able to use that as artifacts and information to guide their assessment and next steps forward.
Okay, yeah, that's fantastic. And the thing I think could be really impactful about this is the role modeling. So, if ACA, if our code of ethics, says anti-racism efforts are really important, or, anything coming down from the association saying, hey, you really need to look at anti-racism. That's one thing. But if the association is doing it themselves internally, that role modeling, I think, is really powerful. So what can large organizations, other behavioral health organizations, learn about being an anti-racist organization using ACA as a role model?
Absolutely. And so we have, a really substantial website, the American Counseling Association. And so on that website, we offer a bunch of resources and also links to resources around anti-racism as well. And so what can other organizations learn? One thing that has been really great about what ACA has done is the visibility of scholars and counselors of color that have been have earned and have been placed in position, right? And so allowing access to spaces where populations have historically and traditionally been marginalized is super important, and providing the supports necessary for that access. We know that when we talk about this type of work, whether that is anti-racist work, whether that is inclusion work, or diversity and equity work, we know that the people who typically get charged with doing that kind of work are people who belong to underrepresented categories or the global majority, but in our, in our context, underrepresented populations. And so we know that that is additional amount of labor to have to do with, to have to deal with when you think about the regular labor of being a counselor or a faculty member or even existing at the margins of society, to then also have to do work around that existence becomes laborious. And so one of the wonderful things in the model that I hope other organizations follow after that ACA has done, they compensate the people for doing that work. Those aren't voluntary roles, right? And so to be a commissioner, there are certain things that you, certain support that you get to send the message that what you're doing is valuable to us, right? We understand that this is additional labor that shouldn't be something that's just voluntary. And can you add this on your to-do list? That we value.
That is so important. Yeah.
Yeah, that we value what you
Yeah.
are doing. And so I really like that model. You know, they need to put their money where their mouth is.
Right, right. So other organizations, like say a large, doesn't even have to be large, but a behavioral health provider that says, okay, we want to look at being an anti-racist organization. So the ACA, they had a task force, they have a commission to make sure things are done, to kind of be aware of all the initiatives of the organization, and looking at how can we make it be how can we look at it, look at the possibility of it being racist. So how can other organizations do that? Would they say, if it's a large behavioral health practice, would that be them having a committee that would be financed, that would be aware of all the efforts of the organization and look at how can it be more anti-racist? Or what would that look like? Does that make sense? I'm trying to see, how is it that other organizations can use ACA as a role model so that they can also make sure that they're an anti-racist organization?
Absolutely. And so I know that for a lot of folks, the word racist, racism, race even, can be daunting terms for some, or even scary terms, or, it's a term or terms that bring up a lot of defensiveness. And I believe the more we say it, then the less scary it can become for people. And so one of the missteps I think organizations make in general is that they really take this grassroots or bottom up approach to addressing issues of DEI, right? And so the people who are at the top of the organization, tend to not be as present in those conversations or in those affirmations or acknowledgements as well. And so even before bringing a consultant in, there has to be a really important conversation at the leadership level about who folks are and what they stand for, right? There needs to be a very clear message that the leadership are committed to, that they then send out to the larger organization. And then bringing a consultant in, and being open about their history, right? Bringing a consultant in to, meet with people at all levels of the organization to do an assessment and to help guide the work that they want to do in their organization. But also, and I hesitate to say this, but I know that it's very much needed. You have to honor the expertise of the people who are most left out of the conversation, right? And so just a quick look at your organization's webpage gives insight into who you are. When you go into meetings, whether those are in-person meetings or virtual meetings, and you're looking at the pictures of the people on the screen or the people on the screen themselves, are you wondering who's missing? Right? And so that gives, like, all of those things give you information. And so it's important to then, once you get the recommendations from the consultant, right, then be committed to following through. And as I said before, putting your money with your mouth is. And so if the way that you do that is developing a committee, make sure that committee has power and not just we're doing this so it can seem like we're doing something around this topic. No, you want to make sure that committee has endowed power, which means that some of those policies are going to have to change, right? So this is what we do, but then also before we do this committee has to sign off on it, right? Before we put things on this committee, right? You want to write the committee in to the policies to make sure that they have power to execute the goals and the vision of what the leaderships have already established and conveyed their commitment to.
Yeah. Yeah, that makes perfect sense. That's really helpful. So it sounds like, the leadership of an organization really having a clear sense of who they are, the fact that they want to be an anti-racist organization, and then another next best step is to hire a consultant, because the consultant's going to help they're going to kind of know how to build these structures in, right? So that it is to help it be an anti-racist organization. And also, it'll also help those things actually be implemented. Because I could think, with for-profit organizations, even nonprofit, probably, I could see how finances can come into play in terms of decisions like how do you make services accessible? How do you market services? What communities do you engage in? Whatever. Who is it that you hire? What positions do you support? All those kind of things. Yeah. So having a consultant or a commission or something like that that's really empowered, I could see that making a difference. Yeah, so I hope we continue to hear more about this. I hope that the ACA's Anti-Racist Commission and also other behavioral health organizations who are doing similar things, I hope that it continues to be visible so that as a profession, we can hear more and more about this and see how this is played out, see how it's implemented, understand more fully how all of our organizations can implement such things. Yeah.
Absolutely.
Yeah. So Dr. White, thank you very much. This has been very helpful. Really appreciate it.
Thank you for having me.